We are going to see the fetal circulation. I'm going to put first the heart. Here is the right atrium, left ventricle, and right ventricle. Alright, first we have from the left ventricle is the aorta. From the right ventricle is the pulmonary artery, the vena cava, superior, inferior, pulmonary veins. Alright. And here we have the placenta. The placenta is carrying oxygenated blood through the umbilical veins because they are leaving the placenta, and what is arising to the placenta is the umbilical arteries that are deoxygenated. Alright, we have 2 umbilical arteries and 1 umbilical vein. Alright, umbilical vein goes here to the liver. First we have here the liver. We have first one anastomosis, well, not anastomosis, the capillaries that give blood to the liver. So here this is the umbilical vein, capillaries, and now the arteries. Here is the vein, capillaries, artery, and this one goes to wherever it goes, and then veins and whatever. Here we also have some branches that bypass the liver, so they do not end in the liver. Here these arise exactly at the point in which the inferior vena cava arises to the right atrium. This bypassing was is the shunt of the umbilical vein. This is the ductus venosum. The ductus venosum is this that bypasses the liver and that now joins with the inferior vena cava and arrives here at the right atrium. Next we have the oxygenated blood coming from the head and the superior limbs, comes to a superior vena cava, right atrium, then through the tricuspid valve to the right ventricle. But also here we have the oxygenated blood coming from the placenta, umbilical vein, to the inferior vena cava, is also coming to the right atrium. And this, because this has a lot of pressure, this blood passes through the left atrium. First to the right atrium, but is like transits through the right atrium, so goes like this and then like this. Here we have the foramen ovale. It haven't been closed because the patient haven't born. It is still the communication, and it is only only when the baby first breathes when we are going to close this. But for now, it is like this. So the oxygenated blood passes from the right atrium through the left atrium, and left atrium, then left ventricle, aorta, all head, neck, whatever, iliac veins. From iliac veins arises the umbilical arteries, and so they arise with deoxygenated blood here to the placenta, and the cycles begin. So we have 3 shunts. First is the combination between the 2 atria. This is a foramen ovale. Next is the communication between the pulmonary artery and the aorta. Here we have the communication, the ductus arteriosus. Alright, so next is ductus arteriosus. We return to this later. Ductus arteriosus. And third, this shunt that bypasses the liver, the ductus venosum. Now, because we have a lot of pressure in the pulmonary, in the vessels of the lung before birth, the the capillaries of the lung has very pressure, and so the blood that the ventricle expulses that goes to the pulmonary artery cannot go to the lung. So from the pulmonary artery passes to the aorta, because we have greater pressure in the pulmonary artery than in the aorta before birth. So the blood goes through the aorta, and now we have more deoxygenated blood, because the ventricle has deoxygenated blood that came from the head, neck, superior limb, right atrium, right ventricle. So we have a lot of deoxygenated blood that we are passing it to the aorta, and then go to the vein, to the legs. All right. So first issue is that blood does not go to the lung. Deoxygenate in other way, that is with the placenta, umbilical vein passes through the right atrium and left atrium. First is we do not use the lung, and other is we have a shunt that goes from the that makes that blood goes from the pulmonary artery to the aorta. Alright, now when the patient is born and first breathe for the first time, we have increased pressure in the left atrium and decreased pressure in the right atrium. The increased pressure in the left atrium is because in the breathing, now we are breathing air and not amniotic fluid, so the resistance of the pulmonary vessels decreases and now open, and now the blood that was in the pulmonary artery can go to the lungs. After they go to the lungs, capillaries, they return in the pulmonary veins, so we have now more blood that is arising to the left atrium. And because the shunt, this ductus venosus also closed, we have less blood coming to the right atrium, so we have decreased pressure here. These changes in pressure makes that the septum primum that was here fuses with the septum secundum, because now blood is coming from left to right atrium, so it closes the foramen ovale. Alright, so now we have the good heart. The first things enclosed are first the foramen ovale, and the ductus arteriosus and the ductus venosum are going to close within hours. In another video, we already saw the pathologies of persistence of the foramen ovale. Alright, now derivatives of these arteries, we have cardinal veins, cardinal veins, umbilical veins, and vitelline veins. The cardinal veins contribute to, at the end, to form the great veins, the brachiocephalic trough or the brachiocephalic vein, the inferior vena cava, the superior vena cava, renal veins, and azygos vein. The vitelline vein drains blood from the yolk sac to the liver, and we have that these veins are contributing to the veins of the liver, that are the portal vein, sinusoids, and the hepatic veins. And the umbilical veins, well, they go from the placenta to the first to the liver, and also bypassing the liver to the inferior vena cava. Now, percentages of oxygenation. In adults, the percentage of oxygenation in the aorta is like 95. In the fetus before, or in the baby before it is born, we have like, well, it depends if we take it like here or after the ductus arteriosus because of this shunt, but let's say that is around 65%. The right atrium of the adult has like 65-75% of oxygen. in the fetus is the left atrium, that is going to have like 60% of saturation, of percentage of saturation. The umbilical vein has like 85% saturation. The portal vein, our portal vein, has like 80% when we are fasting and like 75% when we are when we're eating, and 80% when we are fasting. Also, the most deoxygenated blood is from the coronary sinus, and it is like 30%. Alright, now derivatives. We have the umbilical vein. The remnant is the ligamentous teres, or round ligament of the falciform ligament of the liver. The umbilical arteries now are the medial ligament, the allantoin, first use the urachus, and now is the median ligament. What else? The notochord is the nucleus pulposus. Umbilical arteries, umbilical vein. Okay. The ductus venosum, the remnant is the ligamentum venosum. Ductus arteriosus converts in ligamentum arteriosus. So ductus, ligamentum venosum, arteriosum, and the foramen oval is the fossa oval when it is